Good afternoon, everyone. Welcome back. I'm Jack Chew. This is Chewing It Over. Weekdays, 12:30 till 1. And this year, I think we've done most days weekdays, but usually it's Tuesdays. I've got to usually scarper to get my kids from nursery, but I've managed to postpone that a little so we can have this very important chat on vaccines, because your questions have been coming in, especially over the last few weeks, but even before that, about vaccines, how might we access them, how that's different between different territories, countries, but also different sectors, etc. And so really important topic, and one that I definitely didn't want to sort of generally shoot the shit about and not come from a position of policy. So the CSP has a policy on that, and so we're going to be speaking with Rob Yeldham from the CSP about it. One of the things that we just want to make sure we flag is that I did a Physio Matters episode reflecting on the year with Alex McKenzie. It's been pretty popular and people have been giving lots of feedback, etc. But within that, she misspoke and said that the CSP didn't have a policy on something that she just hadn't noticed because it was pretty new. Easy mistake to make. She put that right on social media, etc. No harm done. However, we just want to make sure that the opportunity we had to amplify some of that at that moment in time, we need to catch up on, and that's what this is today. So for those that feel like there were gaps there, yes, there were, but here we are to fill them, and Rob's going to help me do that. So without further ado, hopefully the technology behaves itself and I can slide in Rob Yeldham. Rob, can you hear me?
I can, Jack. Nice to be with you.
Nice one. So I want to get stuck in then with, because we laughed just off air then about the fact that I said I've been getting lots of questions and you said, well, yeah, you can imagine that you have too. And so the key question that seems to be coming in is, how do I get one of these things? And that's going to vary depending on a few factors. So if you can just start us there, that'd be brilliant.
Yeah, absolutely, Jack. It is complicated, and it's complicated because the healthcare system across the UK is complicated. I think the first place to start is if you work in the NHS in any kind of capacity, whether you're on bank, whether you're a student on placement, or whether you're a permanent employee, your NHS employer is the way to access the vaccine. Because in all the countries, it's the NHS that's actually rolling out the vaccinations. So the easiest thing for employees of the NHS to do is to access it through the NHS. And most employers have got arrangements in place already for that. They will vary slightly by locality and by country. If you're not in the NHS, it can be slightly more complicated. The official advice from the Joint Committee on Vaccinations and Immunisations is that all patient-facing healthcare professionals and healthcare workers should be vaccinated as a relative priority in what they call Tier 2. But the arrangements for actually accessing that vaccination will vary depending on where you are. So if you're in Northern Ireland, there is a national registration scheme. And members of the CSP in Northern Ireland will have had an email explaining how they can access that.
Right.
If you're in Scotland, we're still in conversations with both the health department in Scotland and some individual health boards about what the local arrangements are going to be. But they are clear that they have got a responsibility to vaccinate physiotherapists, support workers, students who are in the private sector, in the charitable sector, in education and other spaces where they're actually meeting patients face to face. In Wales, again, the government recognises that responsibility. We understand that the local health boards will be responsible for the vaccinations in the same way as they are for health and care staff. But again, the local arrangements have not yet been published. So we are pushing for that. And in England, it's now clear that the bodies who are responsible for non-NHS healthcare professionals and their vaccinations are the local clinical commissioning groups, the CCGs. So there's 191 of those. They've all got a local, the ability to set their own local systems within that policy framework that's been set for them. We wrote to them all last Friday with our advice and our request that they actually make public what their arrangements are going to be at a local level. And as we get information on that, we've been sharing that. Some of that is via emails to our regional mailing lists. Where they are allowing us to, we will publish it on our website. And I would direct everybody to the CSP website. I know colleagues have been updating the COVID vaccination section this morning. So the most up-to-date advice and information will be on there.
Right.
And that will also cover the 3 Crown dependencies.
Okay, so on that, when the CSP is written to the CCGs, encouraging them to publish local guidance, etc., what has the advice been, or did you offer a suggestion as to how physios would be positioned?
Well, what we did is we suggested that they should publish their local process, because it's been made very clear to us that they will have local processes rather than a single common process across England. That's not ideal. It's not what we would have recommended, but that is what the system is putting in place. Our preference is obviously that they make that publicly available so that anybody can go onto the website, see what it is,
right.
Either click on a form or a link and be able to register. Some are comfortable with that and are doing that.
Right.
Some are very not entitled using that, so they're asking us to essentially make it available to our members, but not in a public format. And that is not ideal, and it does make it a lot more complicated for us. And there are a few who don't seem to have got the memo quite literally. So the reminder has probably been quite timely for them.
Right. Okay. And is it then in that guidance that you've sent over? Well, not guidance or suggestion. Have you then been able to spell out to them the position of physiotherapist for those that weren't aware?
Absolutely. So what we've done is we've reminded them what's something called the Green Book, which is kind of the Bible for COVID for the health services across the countries. And that has a set of definitions in it about who qualifies as a frontline healthcare professional.
Yep.
And in this context, it's anybody who has regular patient-facing contact in any setting. So that's primary, community, or in acute sector, and in any healthcare provision sector. So could be NHS, could be independent large providers, could be self-employed, could, as I say, be charities such as hospices. It might be people working in special schools. And we've actually gone through a list of some of those examples,
right?
Because we do know that the people who are trying to run these programs in the CCGs will not understand physiotherapy. They will have probably very limited knowledge of the non-NHS sector, except for those organisations they directly contract with. So we've said to them, we know this is going to be confusing and difficult for you. We're happy to offer advice. We have given them that explanation of the full range of kinds of settings they might be getting people coming forward from. And we've also pointed to some of the practical challenges that if they put too many barriers in the way, will stop them actually registering the people they're meant to be registering. Simple things like if they just pick up and use the NHS registration form, it asks for your NHS employee number. Well, you're not going to have one if you don't work in the NHS. So there are some really simple things that just by them being a bit more mindful might help members. So that's what we've been trying to encourage them to think about.
It's a tough thing, isn't it? Because obviously they want to make sure there's an appropriate sort of threshold for governance, but then similarly, as soon as you do that too clumsily, then you're going to exclude some. The only other gap I can think that from what you mentioned with regards to students. So you'd said students on placement, you'd then the trust of which they're on placement with, especially with the vast majority of students being on placement, being in the NHS. I'm interested though and I've heard from some students that are anxious about the fact that they are going to go on placement. So they might well be knowing that they've got a placement coming up, but they don't necessarily have either the details of the trust that they're going into yet. And so they're just generically likely to be in the NHS in a few weeks' time. Do you have any advice for those specifically, or do they need to make sure they get that, they know exactly where they're going before they can act on it?
So what they will need to do is make sure that their placement coordinators are able to tell them where they're going. And one of the things that they should be doing, if it's not already been set up for them, is have that conversation with their practice educator and ask the question, how do I access vaccination? When's it going to happen? In exactly the same way as if you're a member of NHS staff and you haven't had that information given to you. Right. So that's the best advice we can give at the moment. Obviously, the universities themselves are in conversations with the organisations they're placing people into about those local arrangements. So talk to your lecturers, talk to your practice educator if it's not been sorted out by the time you get there.
Right. No, thank you for that. That's brilliant. Now, when I have guests on this show, we always say that you guys who are watching live, you tend to hold your breath for longer than usual. If it's just me, you seem to be heckling and getting stuck in with questions straight out the gates. But when I have a guest on, you leave all your questions till the last 5 minutes. Please don't do that to me today. This is important. We want to be thorough, and so please do get your questions coming in. Like this one from Chris Watts. Thank you. Who's tuned in on LinkedIn. Thanks, Chris. There seems to be a huge disparity between healthcare professions. I live in South Wales. Private podiatrist friend in the same area has been offered the vaccine following talks between local MS. Sorry, I'm thinking, what would that be?
Member of the Senate.
All right. And, of course. And Welsh Government, yet myself and my company aren't being offered. a vaccine yet. So yeah, could you speak to that then? Why might there be disparities between professions?
Well, there shouldn't be. And actually, we hear it's very varied. So absolutely, there will be individuals from all sorts of professions who may have managed to get themselves vaccinated either by contacting a particular organisation that's providing vaccinations, who've just accepted that they'll do it, or because they've been able to get access via, in that case, their local elected representatives. But there is no policy level in any of the countries, a policy that certain professions are in a higher priority than others. Northern Ireland have chosen to call up profession by profession, and I guess that's just a way of them managing numbers, but it's not that they are prioritising podiatrists, for example, over physios.
Right.
And in fact, we know from conversations with colleagues in our sister bodies for the other professions that their private practice members are facing many of the same challenges as ours. So unfortunately, it's because there isn't yet in Wales a clear national approach to how they're going to register non-NHS professionals.
I've got one of the questions that I have, I want to make sure I try and work out how to express this right, but were you surprised at the role that you're needing to take in this? Because I was expecting, and this might have been my own naivety, I was surprised that, say, especially under the AHP banner, that then you'd expect there to almost be a policy that's tight towards that within NHS England, NHS Improvement, that could then be devolved across nations. Was I naive there, or was it surprising to understand where the CSP is having to be quite central to it?
It's probably not that unusual.
Okay.
It's probably something that people probably don't see most of the time, and I guess it's because this is so important to people, quite literal, life and death sense, that it's really important. So people are actually perhaps more aware of what we're doing. I mean, to be fair, we have had really good support, for example, from the AHP lead in Public Health England, who's been really supportive in pushing other parts of the system to listen to what we and others have been saying. And I know that we've had good support from the Chief Allied Health Professions officers in the countries. But because so much of the operational delivery of this is local, it is quite literally individual hospitals who are being asked to be the hubs for vaccination. They're starting from scratch. They're setting up a system for people who they don't normally have any engagement with. And you see this as well with patients in terms of the huge disparities between how far ahead some GPs are than others, and how good they are at communicating with their patient populations. And whilst it's frustrating, and we're doing everything we can to push for a smoother, simpler system, I think we've probably all got to realise that this is the first time in history that we've tried to vaccinate the entire adult population of the country. So there's bound to be glitches as that system starts to gear up.
And especially if you're thinking of the numbers, is that the rollout is accelerating. It's if we were all sat there and we were talking on double digits and worried about the fact that they weren't getting out there, but needles are going into arms as we're here. I suppose I'm interested in that is the professional body engagement not another step in something that needn't be, where Public Health England have had to speak across the piece, including across independent practice. And so it almost feels like the fact that it's great that they've been, and the HP lead has been supportive of you, but it just feels like if they created guidance that then could go directly to, even if it's been delivered locally, if the Public Health England are being listened to, there's some politics associated to that organisation at the moment, but generally speaking, if they said something and the CCGs were then to hear that, or they were to be written to by Public Health England, taking you guys out of that step, what would be the consequences of that?
Well, to be fair, they did issue what they call a standard operating procedure, which is what has made it absolutely clear it is the CCGs who are responsible.
Right, okay.
And that was really important because up until that point, it wasn't clear who in England would be responsible. So that's been a positive step forward. But as is always the case, it's the devil's in the detail. And as I said earlier, we know that of those 191 CCGs, they can be quite variable. Some are excellent and really engaged with not just the NHS, but the wider health and care community in their areas. Others aren't. And doing that translation piece, I guess, is part of our role.
Now, what Susan's mentioned here is what support has the HCPC provided, which I know would be outside of their scope typically, but what's interesting is they do hold the register for the professions, whereas yours is a voluntary membership body. That's what's interesting.
Well, that's a good question. I'm not directly been involved with the HCPC at all in this, but what I would point out is that the people who are eligible are not everybody on the HCPC register. So you can be a practicing physio or podiatrist and not actually be in a role that has a direct patient-facing element to it. And equally, that support workers and students don't have an HCPC number. So it is complicated. And I know that, for example, in Scotland, they have looked at, is there a proxy they can use to quickly identify people? But the problem is that actually the complexity of physiotherapy is that it's not that simple.
That's true, and that's a good point about the HCPC register, is it doesn't delineate us by role, and if it did, it'd struggle to keep up, because that can vary, especially because of shielding therapists as well that might have occurred, and people changing roles because of COVID. It wouldn't have necessarily been caught on that register, so that's a good point. Getting some comments as well as questions. Thank you, Liz Cowan. She said she got vaccinated in Warrington by contacting her GP and CCG. Hearing great stories like that from Liz and others across various different places. Linda Clark, good to see, and thank you for engaging with the private practice world. That has been an important feature, and what Alex talked about on the Physio Matters podcast is there's been lots of lessons learned with regards to the CSP's engagement with the independent sector, and we can see in this instance especially that you guys have really got us, we're in your thoughts and in your policies in a more obvious way, which is brilliant. So thank you, Rob. I agree with that. Chris Watts has then followed up and said, following my question, would you suggest I push my local MS, member of Senate, he's clarified that, thank you, or wait further clarification from the CSP? What would you suggest he does?
Well, it never harms for physios to be lobbying their local elected representatives about issues that are important to them, I'd say. We have already arranged for a helpful member of the Senate to ask the Welsh Government the question. But if others are also doing that, that's helpful.
No worries, no, that's great. Now, in the CSP's policy that was published, I think first a couple of weeks back, but like you say, it's always been revised and updated, etc. One of the things that was consistent with that and what Alex had said, even though she hadn't been privy to it, was she was saying that while she didn't know that you had a policy yet, she was saying the fact that it'd be difficult for the CSP to directly influence what the national policy would be. Now, obviously, you're speaking about how you're influencing things locally, but is it therefore, when you're constructing something like this, is there a degree of symbolism, of principle? Because on that policy, it sort of states the fact, there's a few things there. There's one that the CSP is very supportive of vaccinations as a public health intervention. You then mentioned the fact that you feel it should be voluntary. So is there a degree where you guys need to be, like I said, symbolic because it's highly unlikely that someone's going to be in government reading that and thinking, oh, we'll follow the CSP's lead on this?
No, so I guess policy operates at a number of different levels, and one of the things about the CSP is we spent a long time trying to debate what's a policy, and we kind of came to the conclusion it's just what we think about stuff. So what we think about vaccinations, and why Alex probably wasn't in a position to say what is the policy, is because actually we've never felt the need to write it down in one place.
Sure.
But the issue of are vaccinations positive or negative health intervention probably is a bit of a no-brainer for most people. The issue of the voluntary principle is one we've had to work through in the past, because the whole issue of whether the flu vaccine should be compulsory for health and care workers regularly comes up for politicians. Right. And is something therefore we've had to take soundings on and look at what's the most professional approach to that. So that's the kind of starting point for what we think about COVID, if I'm honest. The challenge in terms of COVID, I guess, and the issues that people probably want to talk about are things like, what are the relative priorities and the tiering and so on. And at the end of the day, our view is that has got to be based on the best clinical advice. And with the best will in the world, we are not the organisation that can provide that best clinical advice. Yeah. So, the fact that we have an independent expert committee that brings together the best immunologists that people can find to give that advice to ministers, by and large, unless there's some really strong counter evidence to them, we would say we should follow that advice.
Sure.
And that is our starting point, and that's why our policy is built around that.
So yeah, you end up in appropriate signposting. It then goes on. So it then goes on to saying, prioritising vaccine programmes, we believe that the disproportionate health outcomes for Black and Asian people should be considered as a significant risk factor. People from BAME backgrounds should have a higher priority for COVID vaccination. I just wondered, is that something that you're suggesting, therefore, for physiotherapy members of yours, that if they're from a BAME background, that they should then be prioritised?
It's really important that the specific risks to Black and Asian colleagues and members are recognised. Now, the JCVI, which is that expert committee, have given their reasons why they haven't done that as a specific intervention. We think there's probably strong enough evidence that they should do, but what we're seeing on the ground is quite rightly some of the bodies that are actually conducting the vaccinations, where they've got more people coming forward than they can vaccinate at a specific point, they are using it as a way to prioritise within those groups.
Right.
So then that seems appropriate in those circumstances.
With what's interesting, because I can on a public level, like en masse for the country, you can understand that the consideration of the BAME community would make sense. But on a professional level, as physios, the socioeconomic factors that seem to be affecting those statistics on what the analysis is at the moment is such that doesn't necessarily play directly into a physiotherapy population, does it? That's the thing that I found interesting about that, is because it almost carries a suggestion, especially amongst a rather middle-class professional class of people, that then is the CSP inferring that the other variables that are claimed, be that, say, genetic, vitamin D, other factors that might affect people's vulnerability to COVID, is the CSP suggesting that independent of socioeconomic factors, then that's actually relevant?
No, we're saying that if you look at the Public Health England's own report into the impact of COVID, that there is a clear impact on those communities, regardless of occupation, professional class, and so on. And I think Kevin Fenton's report makes that fairly clear. The getting into the mechanisms of why that is exactly where we think the JCVI has kind of got it wrong, by getting overly caught up in that rather than looking at what is the actual impact that Public Health England themselves said there is. The reality, I think, on the ground is that people are not, whilst they may be looking to prioritise Black and Asian colleagues, frankly, pretty much once you can get into that system of vaccination, they're so desperate to vaccinate as many people as they can at the moment. They're getting people through pretty quickly. So sure. I'm not entirely sure that the prioritisation, whether that's by ethnicity or whether it's by health condition, is actually making a lot of difference on the ground. Once healthcare professionals are in that system, they're going to get their vaccinations fairly quickly, is what I'm hearing.
Right. And so kind of to my question about when you're putting these policies together, in instances such as that, is that something that you guys are wanting to make sure that that's there for symbolism reasons as much as anything?
Well, it's not just symbolism. We would hope, we're realistic, but we would hope that the fact that we and quite a lot of the other health-related professional bodies have made similar points will make people actually think, are they doing the right thing, and look at the policy again. Right. But it's also important, I think, that if we do think that any of the public agencies got something wrong, we say that. We may not change the world by doing that, but we are part of that broader community of health professions who people do expect us to say what we think, whether that's our members, patients, or our colleagues in other organisations.
Well, that's certainly something that saying what we think is certainly something I would advocate, especially on this show and beyond. So no, that's good news if you're moving in that direction for sure. I'm not even going to try and pronounce what the hell that is. Someone, unfortunately, when people are commenting in the group, I can't get your name come through for some reason. So our Facebook user has said, Welsh Shadow Minister to Health has been very on side about private practitioners getting vaccinated, saying that though no contact yet from the trust. Do we think that sort of thing is going to come out in the wash through time, Rob, whereby the communication starts to drip down, or might there be more obvious barriers?
We think it will. We've been literally every day badgering relevant people in each of the 4 countries, and pointing out that saying that your policy is to include everybody, but not actually putting that in place is not the same as actually doing it. Sure. And as I say, we have been briefing Senate members to ask questions of the government, as well as talking to officials. We've got pretty good access in Wales. Why it's taking quite so long, nobody's quite sure. Okay. The one thing I would say to everybody to hang on to is right across the UK, the governments have signed up to this mid-February target to have all health and care professionals vaccinated. So the closer we get to that, the more sense that they're about to fail on something they've said that they need to do. So
that's helpful, isn't it? Yeah, because no politician's going to miss targets and be hypocrites, are they? So let's pretend that's clout. In Northern Ireland, we aren't able to access the vaccine until the digital platform's live. And so, yeah, there's a comment that then extends to the fact that that's quite a specific issue. Do you have anywhere that I mean, is it just the CSP website, or is there any other things that people need to keep an eye on with regards to specifics on their localities?
So the CSP website will give you general information. One of the challenges we have, and Northern Ireland is one of the places we have a challenge, the arrangements we have with either the health departments or the local health bodies to share their information and their processes, quite a lot of them, as I said earlier, are anxious about those being abused by other people. So we're not able to necessarily just put up the links on the website, even in the member-only areas, and we're not always able to broadcast that in other ways. So what's really important is if you're a CSP member, make sure your online information is up to date. We've got the right email address for you. Make sure you're signed up for your country or regional email bulletins, because, for example, some of the English CCGs have agreed that we can put things out through our regional networks, whereas they're not happy for us to share them in other ways. So people will be seeing the booking links or the information they need to provide for particular localities if they're signed up for those. So that's that's the top tip. Make sure that your membership profile is up to date. Make sure you've consented to get those emails.
Is there a because one of the successes that I mean, Liz Cowan and others had mentioned, whereby they'd reached out to their GPs or even their CCG. Is there any template that could be used or created that we could use to support members to actually submit that information?
So the letter that we've sent to CCGs is available if members want to have that and want to use that as evidence in those conversations. However, the official request in all 4 countries is please do not contact health boards or CCGs directly, and definitely please do not contact your GP, because by definition that takes time away from them actually doing the vaccinations. That's what they've asked us to share. We're sharing that advice.
Yeah, difficult, and I totally understand the need for you to be diplomatic on that. But when people have got those success stories that then go semi-viral amongst our communities, you can imagine that then people want to follow suit with that. And also, it's been said that the GPs that people have spoken to are very appreciative of it being flagged when it might not be clear on their records that someone's that style of health worker. So that's one of the things that's difficult. One of the things that motivates behaviour is those good stories.
Yeah, and I've seen those as well, but I've equally seen the negative stories of people saying how unhelpful some GPs have been. And, so if people choose to do that, it's up to them, but it's not a guarantee that you're going to get your jab at the end of the day, whereas the official systems that are going to be through either CCGs or health boards are the approved routes. So those bodies at some point are going to have to tell you how they're going to register you and when you can actually get your vaccination.
Well, honestly, I thought I'd be sat here talking about vaccine policies and rollouts, etc., with the same sort of scorn as I had over trace and various other different things in part of this pandemic. But arguably, for once, I can say that time passing and the policies revising and refining, it looks like this ship is sailing okay and sailing true. And therefore, I hope that does give those that have been somewhat frustrated, and rightly so, over the course of this time, I hope they can see in this instance things do seem to be moving more smoothly, and therefore time passing is a variable that we're going to be hopefully seeing progress be made as things get refined. Thank you so much for your time today, Rob. Really appreciate it. Is there anywhere else you want to just signpost people quickly before we wrap up?
So keep a regular lookout on the COVID Hub on the CSP website. That's the best place for the most up-to-date information. As we're able to share information, that's where we're updating it.
Brilliant. And someone has just asked, last minute, they've said, Rob, what's the best way to get in touch with you directly?
Good question. So you can either email me at the CSP, so it's Yeldham, or one word, at csp.org.uk, or if you're on Twitter, you can DM me.
csp.org.uk. I'm just putting that into the comments. And so please, make sure that you're careful when you're entering these fields. You don't want Rob to be getting my hate mail. That would not be cool. So yeah, please use that sensibly and sparingly. But thank you so much again for your time, Rob. Appreciate it, and hope for those that have been asking us all those questions, this is a point of reference for people to be signposted to as well. And obviously, any questions that didn't get covered, then let us know, and we'll do our best. So now this is where I try to where possible, smoothly exit. But yeah, that's us done. And I'll see you later this week. We've got a great few clinical topics this week, following my ranting and raving about biomechanics and running last week, which proved popular. We're going to be talking about a few conditions more specific, as well as a few other things following my conversation with John Ryan yesterday about media and how we position ourselves, because I've had some great feedback from our community on that. So thanks a lot for everyone that's joining in, and we'll see you tomorrow for more Chewing It Over.